You are welcome back. Still on acid-base balance. And today I'll be focusing on how the respiratory system can help when we are faced with acid-base balance disorder or derangement. Before moving further, I need to clarify some facts here. When we are dealing with acid-base derangement or disorder, we will be expecting the respiratory system and the renal system to help us. The respiratory system will respond faster than the renal system. The respiratory system will handle carbon dioxide and carbonic acid control, while the renal system will handle the bicarbonate ion control. In metabolic disorder, the respiratory system will be expected to compensate, and if that will be done, it will be done very fast enough. But in respiratory derangement, when metabolic or renal system will be expected to compensate, that would not be as fast as it would be if it's respiratory system that will be compensating. So it will be done very slowly. On that, the conclusion is in metabolic derangement, respiratory compensation will be done within hours. In respiratory derangement, renal compensation will be done in days. Now, respiratory system, breathing center in the brain. What can they do to help us? Both will regulate the level of carbonic acid. Carbon dioxide or carbon dioxide will be increased through hyperventilation. Then the already kept retained carbon dioxide and carbon dioxide will react with water to form carbonic acid. The presence of carbonic acid will then lead to alteration in the value of the pH. There will be a drop. That is the acidosis. Then something will happen. There will be signal from the brain and the control to the respiratory system that will lead to increased rates of respiration and the depth of respiration. The CO2 will then be lost when there is hyperventilation. We'll be dealing with less carbonic acid formation that time. The pH will then start responding by shifting away from the acidic territory to the normal range. Further drop in carbonic acid level will lead to respiratory alkalosis. Now, rebreathing the exhaled air will increase the carbon dioxide or carbon dioxide level again, and subsequently will increase the level of carbonic acid and a further drop in the pH. So it's going to be a cycle. In a strenuous exertion, there'll be an increased level of lactic acidosis. At that time, you will need to breathe faster to decrease the level of carbon dioxide or carbon dioxide and the carbonic acid that will be formed after. What will happen then? The pH will start rising. Remember, this is not done in isolation. Baroreceptors are the carotid bifurcation and the arch of aorta, and arterial chemoreceptors are located very close to the baroreceptors. The chemoreceptors are very sensitive to oxygen, to the pH, and carbon dioxide level. Once the impulse is picked, the impulse will be sent to the respiratory center in the brain, where the control of increased ventilation will be determined. And of course, vasoconstriction will also follow. Hypercapnia is the high level of carbon dioxide or carbon 4 oxide or retention of carbon 4 oxide in respiratory system. So the following will be the conditions when and where we can find high level of CO2: pneumonia, obesity, hypothermia, brainstem dysfunction, encephalitis, congenital hypoventilation, sleep apnea, stroke. Still on hypercapnia causes: botulinum toxins, ankylosing spondylitis, Guillain-Barré syndrome, myasthenia gravis, amyotrophic lateral sclerosis, congestive cardiac failure, opioid use, benzodiazepine, anesthetic agents, and barbiturates. Not all the time that we'll be dealing with hypercapnia. Sometimes we might be dealing with respiratory alkalosis with hypocapnia. And that will occur when there is increased respiratory drive, hyperventilation. And that will be the problem in these situations. Salicylate poison, fever, fear, phobia, anxiety, asthmatic attack, panic attack, deliberately hyperventilating, anger. Also, hypocapnia could be caused by COPD, high altitudes, climbing Mountain Everest or Mountain Kilimanjaro, exercise, pregnancy, ascites, pulmonary edema, pneumonia, and diabetic ketoacidosis. I will conclude the way I started, that respiratory system will respond very faster than renal system in correcting anomalies of the acid-base disorder. CO2 and carbonic acid will be controlled here, while the renal system will handle the bicarbonate ion. In metabolic derangement, when respiratory system is expected to compensate, that could be done faster than in respiratory derangement, where renal system will be expected to compensate. That will be very slow. It will take days. So with that, I've come to the end of this very presentation. We are not done yet. This is part 5. We still have part 6 and 7. So more to talk about. Thanks for listening. Remember to share. Remember to subscribe. I appreciate it.